Child welfare called the particular office I was working in at that time and reported that they had a problem with a sex ring. This was in a community with children aged kindergarten to grade 3. So the school, to their horror, discovered that children were sexually abusing each other in empty classrooms and in washrooms and the playground during recess and lunch hour. No school is really set up to deal with this. There were over 100 children involved in this situation. Each one had to be interviewed. Parents were demanding answers, and it took quite a while to sort out. So eventually, what was discovered through interviews with child welfare and police was that one of the girls was being regularly sexually abused by her father, and she had entered this particular school in kindergarten. She was now in grade 2. So she did what many children do in these situations. She reenacted her abuse onto others, who in turn reenacted it onto others, and so forth, until there was this, what the school called epidemic. Intervention required providing some education to the teachers, to the parents, putting in safety, and ensuring both physical safety of the children, like extra supervision in the playgrounds and the washrooms, in empty classrooms, but also choosing people that children felt emotionally safe with, that they felt that they could go to when they were, and talk about things or ask for help when they needed to. So what are these things called? Some people call it traumatic reenactment. Some people call it sexual acting out. Some call it post-traumatic play. Some call it abuse-reactive children, secondary abuse, secondary traumatization. All of these terms refer to the phenomena of children having experienced some sort of abuse and then reenacting it onto others. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children and, where they have continued to act out sexually. No child wants to grow up to become a sex offender. And most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find therapists that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.